I try very hard to be candid with my patients. I want them to know that not only is this vaccine going to help us return to what we felt like our normal was, but I myself have been double shot vaccinated. I'm ready to go. I'm super excited that I've been able to help protect my family, my patients.
About 424,000 Hoosiers have been fully vaccinated for COVID-19, yet only 4% of those vaccinated are African American. Good evening and thanks for joining us here at 11 o'clock. I'm Nicole Griffin. Tonight, an Indianapolis doctor tells our Amanda Starantino that one problem leading to the low number is hesitancy because of mistrust with vaccines.
Dr. Tranya Hawkins with Ascension St. Vincent tells me she is well aware that many of her Black patients feel concerned about getting this vaccine because of past unethical medical experiments in the African American community. She says despite what has happened in the past, though, she truly believes this vaccine is the safest option for Hoosiers. And she hopes other leaders in the community will share that same message.
In the African American community, there's mistrust, there's concern, and there's worry. Quite often they will confess or admit or kind of like lower their glasses and look at me and say, should we really be getting this vaccine? And a lot of that hesitancy comes from mistrust of African Americans in the medical community.
It's a common discussion OBGYN Dr. Tranya Hawkins is having with her African American patients at Ascension St. Vincent in Indianapolis.
I don't have to tell you, but you are obviously aware the Tuskegee Airmen experiments. You're aware that some women of color were given sterilization procedures or hysterectomies against their will in the past. And there are reasons that individuals would feel less than comfortable with the idea of potentially taking this brand new, fresh out the box treatment when really it's here to help us because we are being plagued by this condition pretty severely.
She is vaccinating patients in their clinic, and she wants to see more Black Hoosiers getting their vaccine.
This vaccine is here to protect us. It's here to keep us safe. And so those of you that suffer from medical conditions, and we're talking about obesity, which is very common in the Black community, hypertension, diabetes, lung disease, heart disease, all these conditions, you are at increased risk and increased risk of severe disease. And that's why, in my opinion, the low numbers are very worrisome and concerning to me.
Dr. Hawkins says she trusts the vaccine. She has already gotten both doses and encourages others to get theirs too.
All it needs to do is help your body develop a response and mount a response that's going to actually make you identify it when you come in contact with it again and make it less likely to make you very sick. And that's the whole goal of this vaccine. We are trying to decrease death and decrease severe illness.
It's one thing to hear this message from a medical professional, but Dr. Hawkins says it is going to take other leaders in the community to make their voices heard as well. Leaders that people trust, like leaders of faith.
Unfortunately, this virus has disproportionately affected the African American community.
Pastor Clarence Moore at New Era Church in Indianapolis is no stranger to loss in the last year.
We lost members. The only way we're going to get beyond this horror is that we get as many people vaccinated as possible.
But even with so many families suffering illness and loss during the pandemic,
a considerable amount of our congregation are saying they're not going to take the vaccine. Number one, they felt like the vaccine came along too quickly. They didn't trust the messenger of the vaccine. And then the historicity of being parts of experiments, not knowing it.
Pastor Moore is working to ease those concerns.
I made both of my shots public, and I created that sermon to whomever will listen about why it's very important that that we put aside all the misnomers and the misinformation. Also, we put together a health team at my church of professionals. They have assured a lot of our church members that there is efficacy and there is safety in taking the vaccine.
This faith leader and this medical professional just want the best for our Hoosier community.
You are important. You have to educate yourself. Don't listen to just something that you heard from a friend. Don't listen to something that someone said at the barbershop or the beauty salon. You have to find out what is best for you. That means calling your provider, finding out what risks you have to have this disease, and get vaccinated. Everyone has this COVID fatigue and we're ready to get back to normal. This is helping us get back to normal.
Pastor Moore hopes that when there's more volume of the vaccine available, that the health department thinks about bringing the vaccines into local Black churches like New Era Church. He says people might feel more comfortable coming into the church in their neighborhood to get their shot. Working for you in Indianapolis, I'm Amanda Starantino, WRTV News.
Amanda, thank you. New Era Church is also putting together teams to help the congregation register for the vaccine and also take them to get their shot.